Hi everyone, this is Dr. Emily Howell from Ashbridges Health Center. I'm doing a series of videos because we are closed due to coronavirus, and I just wanted to help people maintain their, that's better. I wanted to help people maintain their musculoskeletal health while being in self-isolation or staying away from people currently. I'm going to talk about jaw pain because that tends to be a place where a lot of people hold a lot of the tension in their face, and it can lead to headaches as well as neck pain. It's all connected. So usually what I first recommend is being conscious of it. Walk around with your tongue between your teeth. Nobody will know you're doing it, and it'll help remind you to unclench. It's remarkable the number of times I've been looking at my phone, even doing yoga through my day, that I don't even realize I'm clenching my teeth. So half of the battle is being aware. The other part of this is making sure that you work on stretches and you can do some soft tissue release work around your head and face to help reduce some of the tension. So these are some of the self-care things that I teach my patients to do when they're having jaw pain. Just a reminder, if not every exercise is good for everybody, so please check with your own healthcare provider to make sure if this is right for you or not. So the first thing I do is I remind people to do a stretch. So you're going to put your tongue to the roof of your mouth and then open as far as you can without allowing your tongue to come away. Like that. When you open your mouth on its own, it isn't quite as relieving. Somehow the tongue lifting helps to activate the deep openers and closers of the TMJ, and that helps to stretch them really nicely. So give it a try. Like that. Very attractive, I know. The next one is as a massage for the outside of the face. So you're basically going to take 2 or 1 knuckles and work on the masseters. You're going to do a nice circular action. You can do a cross friction. You can do an up and down, whatever feels really great. Basically working right from the cheekbone down to the jawbone, and you'll find a nice thick piece of muscle right there. Usually feels really, really good just to help reduce all that tension in your face, because we're all gripping on pretty tight with all the stress of our current situation. So that's the next one is you're going to take the pads of your 2 fingers and you're going to work your temporalis muscle. That's right in the temple bone. I just recently took a course with Dr. Nicole a few weekends ago before all this started, and Dr. Sarah took this course and highly recommended it. She took it last year. And the temporalis muscle, the instructor basically told us the anterior portion of it actually goes under your cheekbone and then into your mouth. So what we thought was the pterygoids as a major pain generator is actually the temporalis. So you can't access the inside from here, but you can at least release it. So nice circular motion as well as cross friction side to side or up and down. Work on each spot until it feels nice. You can even find a good juicy trigger point or a hard knot and do some gentle pressure work there too. That'll help to relieve it. Taking some nice big breaths. Nice big belly breaths will help relieve some of the tension too. Last but not least, I'm going to use a glove. I know these are hard to find. You can do it on yourself. Just wash your hands, which we're all getting very good at. You're going to use the opposite hand to the opposite side of your mouth, and you're going to run along the top of your teeth. I'll explain it first. And you're going to find the notch where the muscles attach on the inside and just hold. You can also do a nice up and down stroking motion or a side to side, but that'll help relieve it. I have had patients in the past where I've given this homework to. They've come back 2 weeks later, and the first time I attempted to get into between the muscle and the jaw, there was no room. And then 2 weeks later, because they did this every day just for a bit, there was a huge gap and I could actually get my finger in. So the muscle did relax. So I'll show it to you and then explain it more. So you slide along the top teeth right till you get to that muscle. It feels a little strange. And you're going to work up and down, side to side, or just hold that trigger point right there. Side to side and up and down. You can go all the way down to the bottom part of the jaw. The key is that you don't want to go out towards the ear. You kind of want to aim more of a J shape back and down. There is a thin piece of bone in there that you could potentially injure if it is too much pressure. That's why I like to use your index finger, because you can only do about 1 to 2 pounds of pressure. So if you have any questions, please feel free to message or email me. I'm also happy to view your videos to see if you're doing it right. So I'd love your feedback, and please stay safe, be well, and I look forward to seeing you all when this is done. Thanks so much, and be well.